Welcome to Breakdown, Episode 3. Today, we're tackling a feeling I think we've all had. You walk out of the doctor's office and you just can't shake that feeling of, did they really get what I was saying? It's that frustrating sense of being lost in translation when your health is on the line. So today, we're going to break down exactly why that happens and, more importantly, what we can do about it.
Think about it. You've totally been there. You're sitting on that crinkly paper, trying to explain your symptoms, and you can practically feel the clock ticking. You're rushing to get all the important details out, hoping you're making sense. Well, this number gets right to the heart of that feeling.
So get this. Research shows that on average, a doctor listens for just 20 seconds before jumping in. 20 seconds. That is barely enough time to get a sentence out, let alone explain what's really going on with you. Now, this isn't about pointing fingers. It's about a huge fundamental gap in communication that really affects everyone involved.
So let's dive into why we end up feeling so disconnected. This is all about what gets lost in translation.
And you know, this is absolutely not a one-sided problem. On one hand, you've got doctors who are just drowning in paperwork and documentation. On the other, you've got patients trying to decode complex medical terms while feeling rushed. It's kind of the perfect storm for frustration on both sides of the exam table.
And this quote from Dr. Bodrab, man, it just hits the nail on the head. It perfectly captures the tough spot clinicians are in. Do you focus on the person right in front of you, giving them your undivided attention? Or do you turn to the computer screen to make sure every single detail is documented perfectly? It's this constant battle between being a present caregiver and a meticulous record keeper.
Okay, so that's the problem. But how do we start to fix it? Well, the good news is we have tools. Let's open up the Clarity Toolkit.
First up, one of the most fundamental tools we've got is the after-visit summary. You'll probably see it called the AVS. Just think of it as the clear, written game plan you get after your appointment. It cuts right through all the jargon and lays out exactly what was discussed, what you need to do, and what happens next, all in plain language. And this is where things get really cool. Today, AI is completely changing the game for the ABS. Instead of it being yet another tedious task for doctors, AI-powered systems can just listen to the conversation in the background, pull out the key details, and almost instantly create a clear, organized summary. The doctor just has to give it a quick review and personalize it. This frees him up to actually look at the patient, not the keyboard.
Okay, so summarizing a visit is one thing. But what about when you're facing a really big medical choice? That's where another crucial tool comes in, the patient decision aid. And listen, these aren't just your average brochures. They are really well-designed resources that clearly lay out your different options, explaining the real risks and benefits of each path you could take.
And the impact of these aids is proven. Patients who use them are way more informed, they get a much more realistic picture of the risks involved, and, this is key, they end up making choices that actually line up with their own personal values. That leads to way more confidence and a lot less anxiety.
Now, tools are awesome, but they're not the whole shebang. We also need to talk about the actual conversation itself. So, let's get into how to be heard.
For clinicians, one of the simplest but most powerful shifts they can make is to change how they end a visit. Making sure a patient truly gets the plan is a huge part of the job, and there's a specific technique that's designed to do just that.
It's called the teach-back method. So instead of asking that classic, do you have any questions, which, let's be honest, almost always gets a quick nope, the clinician flips the script. By saying something like, to make sure I explain this clearly, it puts the responsibility on them, not you. It's a totally respectful, shame-free way to make sure the message actually landed.
But hey, empowerment is a two-way street, right? What about when you, as the patient, feel like you need to speak up? Or think about this. What about for a first responder, a paramedic who sees something at a scene that feels off, but there's a clear power dynamic? Well, there's a framework for that too.
This is the PACE model, and it's basically a step-by-step guide for raising a concern. You start with P for probe. Just ask a simple, non-threatening question. If that doesn't work, you move to A for alert. State your concern directly. Then C for challenge. Explain the risk you see. And finally, if it's critical, you hit E for emergency, with a clear, firm command like stop. It gives everyone from patients to paramedics a safe ladder to climb when they really need their voice to be heard.
So, when you put it all together, better tools combined with better communication techniques, you start moving toward the ultimate goal of modern healthcare.
And that goal is called shared decision-making. It's really the pinnacle of patient-centered care. It's about creating a true partnership. The clinician brings the medical evidence and the expertise, and the patient brings their personal values, their preferences, their life experience. And together, as a team, they figure out the best path forward.
But, and there's always a but, isn't there?
Here's the reality check. While a whopping 80% of us say we want to be involved in our healthcare decisions, only about 60% of us actually feel heard. And look at this. Less than half of us are even asked about our goals or concerns. That is a massive gap between what we want and what's actually happening. But you know what? Bridging that gap is totally possible. It takes clinicians armed with better strategies like Teachback and patients who feel empowered with frameworks like PACE. When that happens, we can transform healthcare into the partnership it's supposed to be. Which leaves one question: how will you partner with your doctor at your next visit? Something to think about. Thanks for joining this breakdown.